Hi everybody, Dr. Anjana Bhana here, and welcome back to our YouTube channel. And today we have our new baby in the room. It's our Endymed Pro full house. So we got all 7 hand pieces, and today we are going to be doing some RF or radio frequency microneedling. I've been looking and researching for the past 4 years. I was going to go for another popular brand, but I was so blown away by the tech on this device, as well as the awesome support from the company that distributes it here. It's Radiant Health. So Farika is here from Radiant Health. I'm going to ask her a couple of questions before we treat, I'm sure you guys know our Michelle. So Michelle with some RF microneedling. And the cool thing with Michelle is we've already fertilized the skin with a biostimulator called Sculptra, and I'm sure you've caught some of the videos about that. If not, I know the link will be somewhere here to go to that video of Michelle getting some of her Sculptra. So this is some type of regenerative medicine. It's stimulating your fibroblasts for lift, for reducing scarring, for tightening, for fine lines. So it's a really amazing treatment that anyone can do. The cool thing with RF, it is colorblind. So it's great for patients of color. You might have to prep your skin a bit first, but that's why we love it in our practice. So Farika, what is RF? What is radio frequency?
So if you think about its current, radio frequency is possibly a positive and negative that cause friction in the skin, and that friction wants heat, and that's what we want. We want bulk tissue heating.
Okay.
For any lifting, any tightening effect, you want bulk tissue heating.
Okay, and then what's so different about this 3D tech on this device? So
we get very exciting.
Yeah.
So there's a lot of radio frequencies out there, bipolar, monopolar, multipolar, but we are very proud to say Endymed is 3D technologies, meaning there's 3 positives and 3 negatives on each applicator, meaning it penetrates 3 times deeper.
Yes.
A lot more focus control heat, and also like penetration depth is a lot better.
So it's a safer device, low risk of shocking the patient, overheating. There's a lot of safety mechanisms in this device as well. So it's almost, I wouldn't say it's idiot proof, you know, it's still, you have to still concentrate, you still have to know what you're doing, but also gives you peace of mind. And the cool thing is it's medical CE certified, so it's registered with the health department. It's a legitimate device, so you have to be really careful what treatment you are having done. Like, so when you go to a clinic or to a practice or wherever you go to a salon, ask them what sort of tech it is, bipolar, monopolar, 3D, deep, whatever sort of tripolar, also tripolar RF, and the people should know what the differences are, as well as like look at costings, right? This is, I must say, it is relatively reasonable in terms of to the patient, but sometimes if something is really, really low, it's very suspicious. So you don't know where the machine came from, what the support is, what is the power, you know, support, like is the power outage really what it says. So do your homework, because these devices are amazing, but if it's the incorrect device or it's in the incorrect hands, it can do a lot of damage. And the correct hands, us here. So this is our beautiful Bev and fabulous Sheetal, and they will also be doing some of the treatments. So besides RF microneedling, and then this is called FSR, it's like a fractional ablative, like surface ablative, like handpiece. There's also a load of facial and body shaping handpieces. So Bev and Sheetal will be handling quite a few of them for centimeter loss, cellulite reduction, skin tightening, stretch marks. So I'm super duper excited about it. Okay, all right, and then we're going to carry on with Michelle's treatment. What I like about this device is that the needles, these gold-plated needles, are non-insulated. So from the top, from when they go into the skin to the dermis, they uniformly heat up the skin, versus like insulated needles that only heat up the tip. So you get like a lot more collagen tightening, collagen formation, and it coagulates the blood vessels, so sterility is guaranteed. I just like this device. So the worry obviously is pigmentation, post-treatment or prolonged downtime. I must say, there's a little bit of downtime, but nothing that you can't cover up with a bit of makeup. Are you okay in that area, Michelle? Because it's a bit of a sin. Okay. So I personally also had this treatment as well as the other handpiece, the FSR. So those are ablative handpieces. So they actually might cause a bit of pinpoint bleeding, or they go into the skin or they cause some sort of resurfacing. And why I had that was to see, is this safe for patients of color? What sort of reactions you would have, what sort of results. So I was very pleased with it, and downtime. So that's really important. We live in a very busy world, so you can't be, peeling or looking all scabbed and red for days and days and days. So I was pretty chuffed with my experience. And then as you progress, and depending on the type of skin you have and the amount of downtime you have available, the type of scarring you have, you can adjust. Like you can see this panel here, you can adjust the device as you see fit as the operator. So while Sheetal is treating, this is me, this is my disembodied voice, this is Dr. Bhana. So Michelle just said, afterwards, straight after, you feel a bit of a warmth or like a burn. But are you still comfortable, Michelle? Yeah. So afterwards, what we would probably do is put like a anti-stress mask or hydrogel mask, perhaps do some LED as well for Michelle. But the cool thing is you can combine this with other things. I plan to combine it with PRP, some 3D remodeling, so some hyaluronic acid. This handpiece can also do alopecia, so hair loss. It can do excessive sweating, stretch marks, scarring. So I like that you can use it from anywhere. You can use it on any part of your body, face or scalp. So I like the versatility of the device, and this particular handpiece. The other handpieces, you might not all be able to use them on the face, but also pretty versatile in terms of. And the cool thing is, say someone has stretch marks, but they've also got a bit of loose skin, a bit of fat in their tummy. You can combine 2 treatments on the same day. So you can do. They've got a handpiece called Contour. So Contour has a vacuum, and it also has RF, so it heats up the skin while vacuuming it up. So it creates this intense rejuvenation, vortex. So you get tightening, you get shrinkage of the fatty area, and then straight after you can use this on the stretch marks in the area and to also tighten up the skin. So Michelle had a very good comment, and she was saying, when do you actually see results from this thing? So any collagen stimulating treatment, any regenerative sort of treatment from 3 months onwards, that's like collagen production, it doesn't happen in a week. So we usually tell patients, you start looking really nice at 2 weeks, but really from 3 months post the first treatment, that's when you see some really great results. So the same with what Michelle had, the Sculptra, from 3 months onwards, and then improving even up to month 9. How we'd support this treatment, and Michelle's pretty good. She takes collagen subs, especially with these collagen stimulating treatments, and while you're busy doing them, it's really nice to take a supplement like that. For years, Michelle, you've also been using tretinoin, like a prescription topical vitamin A. So that's amazingly anti-aging. Michelle's excellent with her sun care, excellent with her diet, doesn't smoke. So the results that she achieves is like a sum of all those things. Michelle also asked a little bit about downtime, and then she asked about scabbing. So when I had this treatment done, yes, I had a bit of mild scabbing. Michelle, you might not. Some people have pinpoint bleeding, and then you'll see different parts of Michelle's skin reacts differently. So on her chest, it's a bit more swollen, a bit more welting, a bit more like histamine response. Some people also along their jawline. So it's patient dependent. And what we have to remember about this, these needles are gold plated. So if you have any allergies with gold-plated jewelry, or then you shouldn't be doing this treatment, or you have to tell your practitioner, you know. And there's an electric current going through, so no pacemakers. Yeah, I'm told no pacemakers, no epilepsy, no pregnancy, no lactation. So Sheetal is putting on something called anti-stress mask. After this, we might put on, you can put on a hydrogel mask, something we call phytocorrective, any calming post-treatment application. You also get like a topical PRP gel that would be nice to apply. What's important, even though this sort of cools down the skin and calms it down, the inflammation is important in creating the collagen. So when you get home, no anti-inflammatories, no Panado, nothing like that. Okay, so like if you can see, okay, we were on neck and hands for the chest area. It's just the skin is thin on the chest and neck, so it's a bit of a different setting. And now we're going to go onto the face. So we're going to pick the cheeks, and the pulse has gone a bit higher, so that's more like radio frequency in the skin, and the depth as well, it's a bit deeper, but you'd have to gauge from your patient. You know, if someone has like super thin skin, you might have to decrease the depth, or if they're feeling really sensitive because of the heat, you might have to decrease the pulse. I'm not, oh, I am touching it. So this is super sensitive. So I barely touched the foot pedal and it's already shooting off. So we have to be really careful about what we're doing. Okay, Michelle. So guys, I was talking about pulses, and I am referring to the fractionated radio frequency pulses. So like Farika was just mentioning a bit earlier to us, that people often mistake pulses just to go along with lasers, and that's not the case here. And because we're doing the cheeks, and like I said, it's a bit different from the skin of the neck and the skin of the chest, it's a bit thinner. That skin's a bit thinner. So, and the skin on the cheeks a bit thicker, so it can withstand a longer pulse. So, and as well, when I'm not going to go back, but you'll notice that the skin on the neck and chest also have less power, so you have to gauge your patient. So if someone is maybe more prone to PIH, you might lower the power, you might lower the pulse, even if you're doing the cheeks. If someone like Michelle, who's an aesthetic veteran, very very low risk of PIH, has done intensive laser, has done lots of procedures, is quite used to it, we may even increase the pulse. Or if Michelle has there's a bit of a scar there, maybe just on one part of the face, we might increase the pulse a little bit just to get that scar. Or if there's a really aggressive scar on her body, we might also just up the pulse a bit just to get a better result for her.
Up, maybe.
And Michelle is like the more, and the more the better. But we can't always. This is a nice, I wouldn't say it's gentle, but I wouldn't say it's terribly aggressive. And I always say I'm a wuss, and if I can do a treatment like this and have it done on myself, then anyone can. And then Michelle has a bit of lax skin here. It's often a dead giveaway because a lot of the face is very tight, very supple, and then you have this area around the ear, and this is like perfect. It fits perfectly in there. And this would also be really great with bio-stimulators. You okay there, Michelle? A little bit of a sensitive area. So we are at the very end of Michelle's treatment. Michelle was a real trooper. She did her chest, her neck, her full face. So she's looking a little red right now. It'll settle down by tomorrow. There might be slight scabbing. She had a couple of spots of pinpoint bleeding, but so far so good. So Michelle, like we were saying before, no anti-inflammatories, keeping out the sun, keeping out of hot areas, no braais, no steam, no sauna, no exercise. Today as well as tomorrow, I'd say no exercise. And then we've put an anti-stress mask on. We might even do a bit of LED for Michelle, and then for Michelle to be really, really good with a sunscreen. So she's got a couple of meetings tomorrow. It'll be fine. You'll be fine tomorrow. Even though it looks really red now, it'll settle down, and she can wear makeup tomorrow. So guys, thank you for joining me. And Michelle, thank you so much for coming through for a treatment. Michelle is our first in practice Doc Ock. I won't call you a victim, I call you a beneficiary of this treatment. Yes. So from us and the team here, Farika, Bev, Sheetal, thanks for joining me. If you have any questions on this awesome treatment, drop them in the comments down below. Like, share, and subscribe. Bye. And I was looking at the device and I was thinking about, I think I'm a DC fan, but you know, I know Marvel a bit, and it reminded me of what Dr. Octopus from the Spider-Man comics. And what is Michelle my MJ? Okay.